Hi, my name is Grace Solomon. The topic for my Unit 18 assignment is health promotion. What does health promotions mean? A public strategy called health promotion aims to encourage people to have better, more active lifestyle. Moreover, health promotion can help people learn how to prevent diseases and risk. Health promotion appears to be very advantageous because there are many safety precautions and diseases that may be prevented, or the risk of contracting certain disease can be lowered with the proper preparations. Health promotion tactics and goals vary across England, Scotland, Wales, and Northern Ireland. But the primary premise and focus is on encouraging healthy habits and people taking responsibility of their own well-being. Health promotion can also be very effective technique in reducing the strain on the NHS. Many people will use the NHS for mild diseases that they can cure themselves by resting or purchasing the over-the-counter medication from a pharmacy. The yearly flu campaign in England encouraged individuals to get the flu vaccines, which decrease the number of persons hospitalized with flu. Mental health. Since 1 in 4 persons experience some form of mental illness, health promotion can help reduce stigma and increase public understanding of the issue. Diet, exercise, and obesity. Type 2 diabetes is strongly connected to poor nutrition and inactivities, and obesity is on the rise in the UK. Health promotion can motivate people to make healthy lifestyle choice. Change for Life was a health promotion initiative led by Public Health England that debuted in 2009. It was the first nationwide social marketing initiative aimed at combating obesity and health problems it generates. The Change for Life program was started to combat kids' obesity rate and to encourage families to lead healthier lifestyle because these rates were rising at alarming rates. The demographic of this campaign were for children aged 5 to 11 with a focus on families which parenting ideas, attitude, and behavior suggested that their child was more likely to become obese. The campaign's original goals was to prevent childhood obesity. The campaign was divided into four key phases. 1. Alert: informing families about the risks of consuming too much sugar and personalize the message to make it pertinent to them. 2. Implore parents to take control of their child's food. 3. Help. In the bigger Change for Life campaign, which offers family free assistance, encouraging them to download the recently released Sugar Smart app. 4. Making sure kids consume fewer sugar foods and beverages, particularly less sugar at breakfast and less sugar in sugary drinks, as they are the two key contributors to children high sugar intake. Change for Life connects with children and parents and motivate them to adopt healthy living habits using mass media, targeted advertising, social media, school engagement, and mobile apps. These campaign branding concepts and color scheme were chosen to appeal to both children and adults. They are very user-friendly. The majority of society responded favorably to Change for Life campaign because of its ethicism for promoting a healthy lifestyle and a desire to combat childhood obesity. The Change for Life campaign attracted more than 400,000 families in its first year. Change for Life achieved its pre predetermined goals by reaching almost 99% of the targeted household. In the first 12 months, Change for Life attracted 413,466 families. After 6 months, it was estimated that over 44,833 families were still actively working with Change for Life. In the first year, there were over 1.9 million responses, which are posters online, in person, and telephone. Both a separate program for adults in their 40s and new resources for adults with a very young children were launched by Change for Life in January 2010 and February 2010 respectively. The first campaign success allowed Change for Life to grow and offer services to additional societal segments. Almost 1.9 million comments to the campaign were received, exceeding the involvement goals for society as a whole. The campaign was obviously a success because it was being utilized by numerous households and because it was able to advertise as itself as well as gather information and outcomes. As a result of the extensive television coverage and social media coverage, as well as over 2.6 million people downloading the Change for Life apps, the finding demonstrated how individuals, particularly children and families, benefited favorably from this campaign. 74% mom expressed increasing concern over their child's sugar consumption. 3 out of 10 moms said they limited the amount of sugar their child would consume. 8 out of 10 users use the campaign linked app on a regular basis, scanning specific food products. Increased obesity, particularly in children, as linked to excessive sugar consumption. These figures, which are connected to specific families, demonstrate that many parents were concerned about the amount of the sugar their kids were ingesting, and that some families reduce their kids' sugar intake. The second campaign, which is the 8th Don't Die of Ignorance campaign. This, the campaign is launched in 1986 by the UK government in response to the growing AIDS epidemic. At the time, there were a great deal of fear and stigma surrounding it, and many people did not understand how it was spread or how to protect themselves. The goal of this campaign was to raise awareness about the risks of HIV and AIDS and to encourage people to take steps to protect themselves and others. The campaign used a range of media channels to reach its audience, including television, radio, print, and outdoor advertising. One of the most memorable elements of the campaign was television advertisement, featuring a tombstone with the word "Don't Die of Ignorance" written on it. The campaign also demonstrated educational material such as leaflets and posters to school, healthcare work providers, and community organizations. The campaign was highly successful in raising awareness about HIV and AIDS and promoting safer sex practice. According to a study published in the British Medical Journal, the campaign led to a significant increase in condom use among young people and helped to reduce the spread of HIV and AIDS in the UK. The 8th Don't Die of Ignorance campaign was an important milestone in the history of public health promotion in the UK, and it helped to change attitude and behaviors surrounding HIV and AIDS. Today, HIV and AIDS is still a significant public health issue, but thanks in part of campaigns like this one, there is now greater understanding of the risks and how to prevent the transmission. This is my own health promotion campaign, which I have titled Move More, Sit Less. In my health campaign, in my health promotion campaign, I'll be using adults aged 25 to 50 who work in sedentary jobs as my target audience, which their health issues, lack of physical activities, and prolonged sitting due to their job, which can increase the risk of obesity, diabetes, heart disease, and other chronic conditions. My campaign message to these adults will be to make small change to their daily routine to get more physical activities and reduce their sitting time. Even small amounts of physical activities can make a big difference to their well-being. My campaign will start in May, as the weather around this time will be suitable for some of the outdoor fitness I'll be organizing, and this will last until August, as summer can be an ideal time to launch a health promotion campaign, as people are often more active and engaged in indoor activities during this time. Selecting resources for a health promotion campaign. I have selected four resources which I'll be using in helping them. Number one is social media campaign. I will create a social media campaign using the hashtag Move More Sit Less to promote the benefit of physical activities and encourage them by sharing tips for getting more active. Number two is infographic. I will develop an infographic that shows the health risks and associated with prolonged sitting and provide tips for incorporating more physical activities into their daily routine. Number three, I will partner with their employers to offer a workplace wellness program that will encourage their employees to take short breaks while at work to stretch or walk. Number four is community event. I will organize a community event such as working clubs, fitness classes, and health fairs to engage with their target audience and promote the benefit of their physical activities. I have also selected two posters image to support my campaign, which is titled Get Up and Get Moving. This is one of my poster image that I'll be using for my campaign, which has all the activities they can get doing in their daily routine, which can promote a healthy lifestyle choice for them. And this is my second image poster that I'll be using, which says Get Up and Get Moving, which is the image right here. And in this image, I have got a small message that says, small change to your daily activities routine can make a big difference in your health. Take short walk during breaks, stand up while on the phone or watching TV, or use a standing desk, move more and sit less. The rationale for adult health promotion activities is to encourage individuals to take an active role in maintaining and improving their physical, mental, and social well-being. The goal of health promotion activities is to help individuals identify and adopt healthy lifestyle behavior that can reduce their risks of developing chronic diseases, improve their quality of life, and increase their longevity. Non-appendal health promotion model is a theoretical framework that can guide health promotion activities for adults. According to this model, health promotion is a process of increasing a person's level of well-being through their participation in activities that promote health. The model emphasizes the importance of individual behavior change as well as the role of environment factors in promoting health. The Napenda models identify several key factors that can influence an individual health behaviors, including their perceptions of their own health status, their beliefs about the benefits and the barriers to engaging in healthy behaviors, and their social support networks. Health promotion activities based on this model might involve providing education and information about healthy lifestyle behavior, offering resources and support to help individuals make changes, and creating environments that promote healthy choice. Overall, the rationale for adult health promotion activities is to empower individuals to take control of their own health and well-being and to create supportive environments that encourage healthy behavior by promoting healthy lifestyle behavior and reducing risk factors for chronic diseases. Health promotion activities can help individuals live longer, healthier lives. Promoting adults health promotion requires a multifaceted approach that involves utilizing various resources and strategies. Here are some tips I will take in promoting adult health promotions. Number one, Develop plan. I will think of a plan that outline their goals, objectives, and strategies in order to promote adult health, and by identifying the goals of the individuals, resources required, and timeline. Number two, create awareness. Spreading awareness about the importance of adult health promotion through various channels such as social media, public events, and community outreach. Three, collaborating with healthcare provider, community organization to create a comprehensive approach to health promotion, collaborate with local gyms and community centers in providing free activities that can help promote their health. Use technology. We chose technology such as mobile apps, websites, and social media to disseminate health promotion material and track progress. Digital tools can also be used to provide support and motivation to individuals. Evaluate progress. Monitor and evaluate the progress of their health promotion activities regularly. Data can be used to discover areas for improvement and to adapt for my plans accordingly. To implement these steps, resources such as funding, personnel, and partnership may be needed. To seek grants and partnership with local organizations to secure funding, hiring personnel with expertise in health promotion and behavior change to develop and implement health promotion programs. By taking all these steps, I can promote adults' health promotion and create a healthier community. Here are some general steps I will use to evaluate my health promotion campaign. One, I will define the goals and objective of the campaign before starting the campaign. Clearly define what I want to achieve, such as increasing awareness and changing attitude or promoting behavior change. I will target audience. Who is the campaign aimed at? What are their characteristics and needs? Knowing the target audience will help me to tailor the campaign message and activities to their specific needs. I will choose appropriate evaluation method to evaluate my health promotion campaign, such as surveys, focus groups, interview, and observation. By choosing the method that are most appropriate to my campaign's goals and target audience. It is important for me to analyze the data collected to identify patterns and trends and to determine whether the campaign has achieved its goals and objectives. Report the findings of evaluation in a clear and conscious way so I can use the results to make recommendations for future campaign. I will be using the results of the evaluation to make improvement to the campaign and to inform future campaigns. Overall, evaluating the effectiveness of a campaign to address adults aged 25 to 50 who work in sedentary jobs as my target audience, which their health issues, lack of physical activities, require a comprehensive approach that consider both process and outcome measures. It is important to use a combination of quantitative and qualitative methods to assess the impact of the resources and information used. Thank you.